have 964 children in foster care. That's up 1/3 from 2 years ago. 2 years ago, we were hovering between 550 and 600 kids in care, and now we have 964. We currently only have about 128 or 29 foster homes. So what that tells us is that the majority of our foster children are no longer residing in Region 11. And that's a huge impact on our children. As you heard Ms. Blank talk about the trauma that it causes, the additional trauma, when we move kids all over the state, we take them out of their home environment. And not only that, it makes it harder for reunification. It takes them out of their churches. It takes them out of their schools. It further alienates and adds to the trauma of a child coming into foster care. So as we talk about the needs of this region and what's going on, think about the fact that currently there's 964 children not living with their biological parents at this point. They're living with some of the most awesome foster parents I can think of, but we have got to find permanency for those children, either back in their homes or through an adoptive resource. Region 11 averages 250 to 300 investigations a month in my 18 counties. That's a lot of investigations. Our investigations are up about 100 over what they were last year. We're averaging roughly 100 more investigations per month than we did a year ago. So some of that, we saw an increase when we went to the centralized intake unit, but we've seen more of an increase in the last year, and central intake has been around a little longer than that. We're seeing a lot of drug issues. I know there's some law enforcement in here that can attest to the drug issues we're having. We're having a lot of drug issues in our rural counties. I have one rural county that went from having roughly 30 kids in foster care 2 years ago to having over 100 in foster care right now. The majority of those kids came into care for drug issues. We have 330 open, ongoing CPS cases. That's where we continue to work with the family after an investigation, but we're trying to put in enough services and heal that family so that we don't have to bring those children into foster care. In Region 11, a lot of our children come into care from open CPS cases, whereas in some of the other regions in the state, children come into care straight from investigations. In Region 11, a large percentage of our kids come from open ongoing cases where we try and work with the family and stabilize them prior to them coming into care. Sometimes, as we talked about the lack of resources for transportation, it's very difficult sometimes to get the needed resources in some of our rural counties. Psychologicals, things like that, sometimes we have to take our children a long distance to get. Those are all barriers that hinder the progress sometimes in Region 11. I will tell you that we have some of the finest staff in Region 11. I have awesome county directors and staff, and we get our kids where they need to go. Sometimes we don't get them there as expeditiously as we need to. So anytime you've got any issues, please let us know so that we can help you with that. We have roughly 200 family support cases that we work every month. Those are cases that don't necessarily rise to the level of an investigation, but the family needs some services. And when we're working those cases, we're just as diligent in those cases as we are on an investigation. We're plugging those families into services, and we're helping them to stay on the right track. So we work a lot of those cases each and every month. And right now, we've had a lot of turnover in Region 11 for a variety of reasons. You know, casework is really, really hard. It's a life dedication. It's a lifestyle. It's not just a job. In order to be a good and effective case manager, it's a lifestyle. You have to love your job, and it can just totally consume you if you're not careful. A lot of our caseworkers suffer secondary trauma from some of the things they see, and all that leads to our turnover, as well as high caseloads. Right now, the average caseloads, if you just went across the board for Region 11, are roughly 35. Caseloads need to be a little lower than that. I'm aware of that. Director Cagle's aware of that. And we are working toward bringing people on. We've been given new positions, but it just takes time. I'm real proud of Office of Family Independence. We've gone back to doing casework in the county offices again. And I think the clients are happier. I know my staff are happier. They like to be able to reach out and touch individuals. So those are some of the things that are going on right now in Region 11. I would be more than happy to answer any questions anybody may have. We have the bios for Stephanie Blank and Director Cagle in the package you were given. So I'm not going to spend a long time introducing them, but I would like to introduce the Director of the Department of Family and Children's Services, Bobby Cagle, and I'm going to turn the program over to him. And we are just so excited that he is here to talk with us about the blueprint for change and where the department is heading, because it's really exciting.
Thank you very much, Peggy. I think if you can hear my lapel mic, I'll do this without the handheld mic. Thank you so much. I have to tell you, it is just thrilling to me to see this number of people come out after a day of work to talk about the welfare of the children in your community. I've honestly got cold chills standing up here because this is probably the largest group that we've had easily. And we've done this in 6 other locations around the state. So first, let me thank you for being here tonight. I want to just share a short story with you to let you know why I do this and who I am. I was raised in North Carolina, but my story starts a long time before that. My parents were married in 1960, and my mother told me recently that she prayed for a child for 7 years. And it wasn't only her, but it was her and her 4 sisters and her mother and their church that got involved and prayed for 7 years. And they said that our family members did it every night for 7 years. And my mother couldn't have children. And so little did she know, in another part of North Carolina, there was a young mother who got pregnant out of wedlock. And you can imagine in 1967, being pregnant out of wedlock was a very looked down upon thing. And I think truly by the power of prayer and divine providence, there was a social worker that found me for my parents. My mom was home from work one day, and this will tell you how different the adoption system was back then, anybody that's adopted in the room. My mother's home from work one day for lunch, and she gets a telephone call. And she answers the telephone, and a lady on the other end says, "This is Ms. So-and-so from DSS. You and your husband need to go to Charlotte to this location tomorrow to pick up your son." And my mother said, "I'm sorry, excuse me, did what?" And she said, did your husband not tell you that he came in and applied to adopt a while back?" So you can imagine what kind of conversation ensued after that with her and my dad. But she ran out of there, and my father and grandfather ran a painting company. So they were painting First Baptist Church in my hometown, where I grew up in that church. And my mother went headlong running through the front door, and they had scaffolding set up. She proceeded to knock herself cold. And as she woke up, my dad said, everybody was trying to figure out why she was in such a hurry, and all they could get out of it was, "We've got to go now, we've got to get ready, we've got to go to Charlotte, we've got to pick up our son." And, I tell you that just to let you know where my heart is. And this is really where my heart is. I honestly think I was born to do the job that I'm doing. And I'm very, very happy and very proud to be doing it. Because there are children just like me all over this state, all over this country who need the help of good families and the love that a good family can bring. Now, my family wasn't rich. Matter of fact, they were probably poor in many ways, but they were rich in love. And they gave me everything that they could give me. And at the same time, I had a social worker that remained a part of my life for the remainder of her life. Until just a few years ago, she and I remained in contact until she passed away. She was a mentor for me, and I remember writing her a letter one time in college, and I said, I think I may want to be a county director of social services one day. And she wrote me back, and she says, back when you wrote letters, she said, "Son, you can do anything that you want to do as long as you set your mind to it." And so she was an encouragement to me for the rest of her days. but really set me up in life in a way that I couldn't have imagined as a child. And as I've grown as a professional, what I've learned is that kids that come through foster care that don't get linked up with adults that adopt them, or at least somebody who remains a part of their life and encourages them and takes care of them, they're more likely to be undereducated, unemployed, in prison, or dead than any child in America. And so that's the kind of seriousness that we're dealing with here. And so very pleased to be with you here tonight. The governor asked me 17 months ago to come take this role. I previously served with the Department of Early Care and Learning as commissioner there. He knew when he did that I had this story behind me. He also knew that I'd spent most of my 26 years in social work and child welfare. And so when he asked me, I said, absolutely. I walked around for about a month after that, people offering condolences and a variety of things. But, I say to everybody that I'm very pleased to be here and do this, because there are great people all over this state that work every day to try to make sure that children are taken care of and that they have everything that we can give them as government. There are also foster parents and others in the community that help foster parents that serve these children every day. And so for those of you who do those things, those of you who have adopted, who are foster parents, who are serving roles that I may not even think of right now to help these kids, thank you very much. The reason I'm here is to talk with you about what we call the blueprint for change. When I came aboard, we were facing a lot of problems. We had children that were dying in suspect circumstances at the hands of their parents. And I know that a lot of these we can't really affect in some ways. We can do the very best job we can, and we can't be with parents all the time. The best we can do is remove a child when we think it's too dangerous for them. But I also know that if we do things in the right way, that it makes it more likely that we will be able to work with the family. There's a way to approach people, and there's a way not to approach people. I look back on my career, frankly, and when I was a new social worker, I was so gung-ho, I probably offended half the people that I ran into because I was so intent on making sure that children were taken care of. And not knowing at that young age that if I was just a little kinder and went in with a little easier approach, I would make it a lot more likely that the parents would work with me to make sure that their children are okay. So what I have accumulated through all those years, I've tried to encapsulate in what we call the Blueprint for Change, and you have that document in your packet. It's very simple. Blueprint for Change is 3 things that we are going to be trying to do over the next few years. First is a practice model, and it does exactly what I was just talking about. A practice model, for those of you who aren't social workers, basically just is a standard way that we train folks to be able to go into a home and talk to families about issues that they're having and make it more likely that they're going to work with us to achieve what we want to achieve, which is to keep the child safe, first and foremost, but to also keep the child with their family, if at all possible. I look back on my experience, and as great as I had it, I had a whole family full of people. All those women that prayed for me every night, 7 years before I was born, they all took care of me. I was taken care of by all of them. And so I had something that most children can't have and don't have, a big network of people that want to help them. But what we can do is work as government, work as communities to try to surround our families to help them do the things they need to do. So we're going to be working for the next 2 to 3 years, training all of our staff. This is a big effort. This is an undertaking where we're going to train at least 2,500 people in how to approach people in the right way, the tools to use in order to get them to change behaviors that endanger children. And if you think about it, a lot of what we deal with is really about behaviors. I use myself as a good example. So I have behaviors that I need to change, and I would think if I ask most of you, you could tell me something you need to change. Mine is that my behavior does not always lead to my maintaining my weight. And I get lazy and I start eating the wrong kinds of food. So I quit exercising and I eat the wrong food. That behavior is just like the behavior that you have when you are drinking. If you have a drinking problem, that's a behavior, and you can learn to control those behaviors. Many people do. You can also learn to control behaviors when you have children that need supervision. That is a lapse into a behavior that a parent doesn't want to have. So part of the practice model also helps them understand how to prevent relapse into old behaviors and to set up a plan in the event that they do slip back into that old pattern of behavior that will keep the child safe. So we try to make sure that we've got a plan if a person's left their child unsupervised too much, that they'll have somebody that they can call that will already know what the call is about and will take that child to keep them safe. So very, very important work on that model that we've got to do. It's very complex, and we'll do that over the next couple of years. The second part of the plan is about our workforce. When I came aboard in June of 2014, we had 60% of the positions that we needed in order to do good child welfare. So think about your favorite football team on Saturday. You put your team out on the field, the other team puts their team out on the field, and immediately you pull 5 of your players off the field. Now what's going to happen? Not going to have a very good game, right? And so that was really the situation that we were facing. We were working as hard as we could work. We were working people overtime, and we were really behind the 8 ball. And as soon as I came aboard, I went to the governor and I said, we've got to have staff, and we've got to have them now in order to be able to keep these children safe. And true to his word to me, when he asked me to take the job, shortly thereafter we had 278 new staff. Since that time, we've added another 175, so we've got more than 450 staff in the last 2 budget cycles. I suspect that we'll have at least 175 more coming after July 1st of this year. And they couldn't get here quick enough, frankly. And I want to thank the legislator that is here, and there may be others that have joined, for the support that they've given us. This is not a cheap endeavor. When we add 175 caseworkers, that's $7 million a year that we have to spend on that. But it's all very, very necessary. The other problem that we have is that we turn over 36% of our staff every year. It's extremely stressful work, and when you put caseloads of 35, as Vicki said, on caseworkers, you can do that for a little while, but I can tell you from personal experience, having worked frontline, that you can't do it for a long time, because the amount of work will get you, but what will really get you is if you care about what you're doing, you'll lay in bed at night looking at the ceiling thinking, I didn't get to see that kid today, I wonder if they're okay. And the combination of the loss of sleep and all the hard work you do is really impossible for many people. So getting the additional staff is going to be important. We've also increased salaries, and we are really trying to change the culture around the way that we treat staff. We have to be much more considerate of staff and their family obligations. The ironic thing is that oftentimes we have asked our staff to do things to protect children that made them be away from their own children. And so we have to do much better than we've done in order to be a good employer. And we're working on that. And then the last thing that the plan entails, and people look at me and say, well, this is just common sense. Well, they say that common sense ain't so common anymore. For many years, DFACS has tried to work in isolation. We haven't really talked to our community, especially the state office. We worked in Atlanta in our offices and rarely ever ventured out into the community unless there was a problem. And if there was a problem, I was in a position before I went over to be the Commissioner of Early Care in Marnie, my job was to go out and fix the problems when they happen. And instead of taking a proactive approach and going out and talking to the community about it, we thought we'd fix it after the fact. Well, we tried that for a long time. I ran myself to death all over the state trying to do that. And as I came into this role, I decided I wasn't going to do that anymore. I decided I was going to proactively go out and talk to the citizens of the state about what they want for the children. And that's exactly what we're doing now. We'll spend, we spent today and we'll spend tomorrow, actually got here Sunday, and we will meet with a variety of groups. I met with most of the legislators that serve this area. We will be meeting with the faith community tomorrow. We met with foster parents today. I'll be meeting with my staff. I have to tell you that it's very surprising to me when I've had a couple of staff say that they've worked for the division for more than 20 years and have never met a DFACS director. And so that tells you something. It tells you that it's been a long time, too long, for me to get out and do this, let alone those that came before me. And so it's all about, in my estimation, us trying to train our staff to the best extent possible, but also to work with the community. We're working with the faith community right here in this region and doing a lot of great things around getting things that children need that we can't buy as government. We're also recruiting foster parents through the faith community. And what we heard from the faith community everywhere we've been, I have talked to at least one pastor who said to me, I had no idea that you needed these things. And so it's a part of getting out and talking to people. And to some folks, this doesn't seem that important. To me, it's essential. And that's the reason we're here tonight. Stephanie Blank, who you heard earlier, is a volunteer. is a volunteer. And she has been a wonderful help. And if it weren't for a catastrophe at her house, she'd be here with me tonight. But I'm very pleased to have her with me, and I think we're going to try to have her join me for the Q&A session. So you guys are getting the very best of technology that we can deliver, and I keep my fingers crossed that we're doing it well. So we're going to start taking some questions at this point.
Well, Bobby, I should have just not said anything. You see what you said about me when you thought I wasn't here.
All right. So Stephanie, you're going to help answer some questions too, right?
Yes, I'm here on the line.
All right. Good evening, everyone. I'm Kathy Rages. I'm the statewide liaison of the Georgia Family Connection Partnership and the University of Georgia Extension Family and Consumer Sciences. And if you have got a question, if you'll just hold up your card, we'll be coming by and getting them because we've got some great questions. And I'm going to be asking them, and Stephanie, you and Bobby can determine who's going to be answering them, if that's okay with you. But I just want you to understand, all of you will have your questions answered. And as was mentioned by Susan earlier, we can't do any case specifics tonight because of confidentiality. But this question, I think Director Cagle is for you. One person says we don't have staff, and another says we have hundreds of positions. Why aren't there enough staff in South Georgia to have the caseloads down?
Well, I think what you'd find around the state is that caseloads are large everywhere. We have worked extremely hard to try to make sure that we divide the staff appropriately. On a monthly basis, we look at the positions that we have, those that have been vacated. We look at the caseloads across the state, and we try to divide those as evenly as possible and try to concentrate on the areas where you have the highest caseloads. I think Vicki will tell you that we've got 2 rounds of staff that are coming. It just takes a little while to get them hired, to get them trained, to get them in the field. So there is help on the way. So if you're a caseworker in the audience, know that we know that you need additional assistance, and we're sending assistance as quickly as we possibly can. Our intention is to be at a 1 caseworker to 15 case ratio, and that's the promise of the governor. What we did not anticipate when we made that promise was that we were going to have an 80% increase in the number of reports that we received between 2013 and now. And so what that has required is that we go back and do more estimates. Initially, we thought 550 staff would take care of all of the staffing needs we had in the state of Georgia. Now we're looking at probably needing another good 450 staff to be able to meet the needs that we have right now. And again, that is a commitment in financial terms that we have to convince the legislature of. And so I always tell my folks, talk to your legislators. That is very important. You need to be telling them what the circumstances are. Those that can't be here tonight, talk with them. Many of you know them personally, you go to church with them. And I can tell you the ones that I meet with are very interested in knowing what the conditions are in their counties. And I think they are very willing to step forward and help as they can. Of course, this is a big state. There's 10 million people, 159 counties. And there are a myriad of things that have to be taken care of for a population that large. And so I go as aggressively as I can after all the positions I can get and all the money that I can get. But you have to know that there are division directors and commissioners and departments all across the state doing equally good things that are doing the same thing. So we get in there and compete for that like the Dickens, and I try to get you everything I can. My hope is that you'll be getting some additional staff here in the very near future.
Thank you. Stephanie, what changes will the Commission on Child Welfare Reform propose to end the backlog of cases in juvenile court?
Can you repeat the first part of the question?
What changes will the Commission on Child Welfare Reform propose to end the backlog of cases in juvenile court?
The backlog of cases in juvenile court. Well, that's the first time we've had a backlog in cases in juvenile court come up. Did the person who asked are they in the audience?
Yes.
Maybe they can provide some more specifics. I mean, we've
Rick?
addressed the backlog of cases within case managers in the field, which Bobby just spoke about. This is the first I've heard about a backlog in the court system.
Stephanie, would you like to phone a friend?
Maybe Director Payton might.
Peggy Walker, yes.
I can answer that question. A couple of years ago, we did something that had been needed for many, many years. I guess it had been 30 years since we had revised our juvenile court codes. And many people worked on that process for years and years and years. One of the things that we did as part of that was we made the frequency of permanency hearings in court vary according to age. So because children at younger ages need things to happen more quickly, we decided that it was appropriate to have hearings more quickly. As you get older, you go on out to a longer period of time, which is you have a permanency hearing about every 6 months. But you want to get down to about 3 months on those that are very young because you don't want them lingering in foster care. The unintended effect of that was that we have courts that are backed up right now. We have been talking with the governor's office. I've been talking with the Council of Juvenile Court Judges about this very thing. The combination of the large increase in reports that we are receiving now and the expedited time frames around permanency hearings for children has caused a backlog throughout the state, not particular to any one area. And so that is something that I will be talking to the governor about on Wednesday morning. So great question.
This one relates to making it easier to report child abuse and neglect, and without having to go through so many channels to do that. And similarly, allowing people to talk to local workers rather than having to go through a long distance person.
Sure. So first let me explain to you what the situation was prior to us going to a centralized call center. At that time, this was prior to September of 2013, we had a system that involved 159 different ways of taking Child Protective Services reports. Every county did it differently. I can tell you I went for a period of time to be a temporary director in Fayette County. Great people down there. The lady that was taking the reports had been there a long time. She was a clerical person on the front desk. So I walked in the first day and was standing behind her as she was greeting people and also talking to someone on the telephone about a Child Protective Services report. Doing double duty on something that really requires full attention on that very thing. The other thing that was happening is we did not have a capability to take reports in most counties in the state after 5 o'clock or on weekends. And then, even further problem, we had a situation that was occurring, I think more than we know, where social workers were taking reports and not handling them appropriately. And we have an example in Muskogee County right now where we have 2 workers that are under indictment because they were not entering all of the reports that they received. And so, in consideration of all those things, we decided to go to a statewide automated call center. And we have worked through a lot of issues with that. Initially, there were a lot of delays. But we are now down to a 9-second hold time. We also know that our law enforcement partners don't need to be on the scene and have to wait to go through an 800 number. They need to be able to get directly to the people in their county. So law enforcement officers, the 911 centers around the state, all have the list of cell phone numbers for everybody in the county that will be doing rotations, as well as the county director and the regional director and my cell phone number. And so we are taking steps to try to refine that as we go along. We saw it as something that was really essential. If you look at the 80% increase after we instituted that call center, I would say to you that there are several things that have gone on there. One is that we know nationally that 2/3 of all child abuse and neglect is never reported. The second thing is that we know that the number of reports go up when there are high-profile child deaths, and we've had those. But we also have good evidence to say that not all the reports were going in the database. So I think there was a real combination of things going on there. Although it's not a perfect system, we work to perfect it every day. If you're having problems with that, we're more than happy to talk to you about it. We've actually done some things for mandated reporters, those people that make reports on a regular basis. A good example of this are counselors at school. Oftentimes they have to make multiple reports in a short time frame. So we've set it up so they can actually do the entry of their reports online and submit that and automatically get a receipt back showing that they have submitted those reports and can prove that they submitted the reports. It's a system that I think is much better than what we have. I hear you, and if there are problems that we're still experiencing, if you're not get through, talk with us afterwards because I need to know about that so we can go work on it.
Thank you.
Medicaid numbers for newborn babies and how they're going to be able to get their medicines if they're no longer covered under the mother's Medicaid.
Absolutely. So newborn babies, John, do you want to try to answer that?
I can try to. Can you read the question? Make sure I understood it.
John is our on-site expert with regard to all things Medicaid, food stamps, child care, and TANF.
So what's going on with Medicaid numbers for newborn babies? There's somebody, and I know we've been having there's been some system issues that DCH put in place in April that's caused some impact between the de facto eligibility system and going into the Medicaid system itself. And they're working on corrections in those. They know what those issues are. But if you have some that are not having, getting those updates as quickly as possible, if you could just let us know, we can get them updated. We have processes in place where we can notify DCH and their fiscal agent to be able to update those cases quickly. The system fix should be in the next couple of weeks. They've identified what it is. And it's not been a huge impact that we've seen, but there have been some spotty areas. So if there's somebody that may have more information, or more detail on this question? Is it?
So what I would suggest is if you're having the issue that's been described here,
We're not able to bill those patients for like 69 days.
Also, the billing question, not a Medicaid.
And the babies aren't able to get the medicine because they're not.
Okay. There might be a longer conversation you know, I might have, and that we'll talk about that afterwards. And we do have somebody from DCH in autonomy that's here, but anybody from DCH, you should say, okay. If you wrote about it at the end of the day, just come talk to me.
thank you, John.
For 5 years in a row, when your county was #1 in child abuse and neglect, we're now number 35 in the state. We're a rural community with 40 kids in foster care, with none of these kids in Lamar County because of the lack of foster homes. My question is, what is the state's direction in training and recruiting foster families? And just maybe to tie into that, what steps will be implemented to increase parenting classes and training and reduce the number of children in foster care and to recruit more foster parents? So it's all.
Okay. Stephanie, do you want to address the council's stance on this and what you've done on it?
Yes, so as a part of the commission's work, I didn't mention this in the first part, but the commission's work is continuing on into this year as well. So we will be coming back to the governor with an additional set of recommendations. But in the interim, as we do these road shows, we are in particular speaking with the faith-based community. There are several models out there utilizing the faith-based community that have been very successful in creating not only more foster homes, but providing better support for current foster families so that they don't feel the need to have to exit the system. So that can be anything from supplies for newborn, new respite care, for older kids. So we have been doing that. What we're going to be doing in this, we have a subcommittee that's specifically working on nothing but foster care family supports. It is made up of those foster parents, foster care providers. We have a good wealth of expertise on the subcommittee, and they will be coming back with a full set of recommendations, some of which may be policy driven, some of which may be more budget driven. And then there are also ways that we think we can engage the communities more. There are several good examples. One is a program called Uniting Hope for Children. The director's name is Wayne Naugle, and that's Naugle. And they've done an incredible job at building supports around foster families, but also recruiting new foster families. And Wayne's very inspirational. He and his have brought in to foster children and adopted them. So that's one example you can look up. In terms of parenting programs, we don't have anything specifically set up through the council to address parenting programs. However, we do know that getting to parents, particularly if they're young parents, and getting to them early, which is why I mentioned home visitation, can be so powerful. Home visitation programs have been shown to increase maternal and child attachment, decrease child abuse and neglect, and improve the cognitive and social emotional functioning of the child. That's something that the community can decide to support as well. So I think that there are some really good examples of ways to reach parents. One thing that we do know, and we have a great partner in Savannah, Georgia, it's called Baby College, is that when you set it up as a parenting program, that some people can view that negatively and find it a little offensive. So programs that have called it like Baby College, for instance, have been really successful because it's all about making the baby smarter, more successful, healthier, better adult, and parents all want children to succeed. So as you think about what you might do in the community, I think somehow how it's presented
this is a very important question too. If I could expand on what Stephanie said, I want to tell you how we got to the point that we're in what I call a foster care crisis. And this is a lesson that we need to learn and learn well. During the recession, we had to cut a lot of money from our budget. Every state agency did. And it was simply because there was not enough revenue coming into the state in order to cover all the services. What we did as an agency during that time was we started out doing things like cutting what we call non-essential positions, things that a lot of clerical staff went first thing. Then we went to 4 furlough days a month, and so we basically all took a 20% cut in pay to help make ends meet. The next round was, and they kept coming back to us and saying, give us 5% more, give us 5% more. So eventually what we got down to was having to cut frontline staff out of our budget. And as we did that, we looked around our organization and said, how can we get more people to doing investigations, for instance. And we had something called resource development staff. Many of you may be familiar with that if you are a foster parent, because the resource development staff recruit foster parents, they train them, and they service the homes to try to help them stay with us. Now, that at that point in time looked like a really good opportunity for us to move those staff to the front line and have them do investigations. Unfortunately, what that did for us long term was that it caused us not to have the capability to recruit foster homes like we need to. And so now we're in a crisis throughout the state. The one county that was named is only one example. We are transporting children all over the state of Georgia on a regular basis because we don't have enough foster homes in those communities. So part of what we're trying to do is exactly what Stephanie said. We're trying to recruit through our churches, through any community group that will assist us, and we're having some good success, but it takes a little bit to get those homes recruited, get them trained, and get them out there. These things don't happen quickly. And so as we go through, I hope to goodness we never experience another recession like we had. Many people lost their jobs during that. But we also need to learn the lesson that if you pull those people off of recruiting foster homes, shortly down the line, you're going to have a foster care crisis like we have right now.
And this kind of ties in asking about educational qualifications for state caseworkers and how their salaries compare with some of the other state agencies like correctional officers in the high 20s, low 30s thousand salary, and how you can get more MSWs, and how we recruiting and training.
That's great. So how we compare across the board, I can't tell you what we make in other agencies. Many of you may be able to tell us more about this. I can tell you what we make. Our frontline case managers, if you have a 4-year degree in social work, then you start out at around $28,000 a year. If you have a master's degree in social work, you start out around $32,000 a year. If you look to the private sector, a master's degree in social worker can walk out the door at their school and go across the street to a hospital and get a $40,000 a year job any day of the week at a much more predictable schedule with less stress. So we do have to do things that are really aimed at trying to recruit and keep better staff. Higher salaries is one thing to do that. We were able to give the first significant raise in many years last July. We were able to give between 3.5% and 8.5% increases to our caseworkers based upon years of experience. So if you had 10 years of experience or more, you got an 8.5% raise. That is really to make up for years from 2007 on through 2011 where there were no raises whatsoever. We're still working to build a plan to raise the beginning salary up, and we're going to have to do that if we expect to be competitive. As far as recruiting master's degree in social workers, we have reinstituted a program that we call the Title IV program. It's named that because there's a federal fund source called Title IV that we can draw down to pay for the education for both bachelor's degree and master's degree social workers. The thing that they have to do in return is they have to work for us a year for every year that we pay for. And if they fail to do that, they have to pay us back. We know that this is very effective because we did it for many years. And if you look around our tables at leadership meetings around the state, many of the people you see sitting there are the people that went through those programs. There's something about going through the programs, and I think part of it is that you do work in our agencies. So you work in DFACs in order to get those degrees. There's something about them knowing what they're going into that helps them deal with staying. So they're more prepared as they come in. And we've just reinstituted that. We're in 5 institutions around the state. We should, in the next year, have at least 8 institutions around the state that will be offering that program. And my hope is that we're going to have a lot of really highly qualified social workers coming out in short order.
With the additional positions that were added in the last few years, Region 11, how many per year?
Frankly, I don't know off the top of my head how many positions came from Region 11. We can get that for you and share it with the whole group. I can tell you, as I said earlier, that we tried to take a look proportionally where the highest caseloads are. Region 11, because of what we talked about earlier, has been at the top of the list, or near the top of the list, in both the last 2 rounds of position allocations. Just takes a minute to get those people hired and trained and into the field, which is at least a little consolation to those case workers who are carrying 40 cases right now. And we're getting them out as quickly as we can.
211 system says in most parts of the state, 211 offers help for people to find resources. Region 11 had a 211 system that covered 18 counties and works their way across. Could DFACs become involved in that 211 services to make sure that people can find the resources they need?
That's a great question. I'm familiar with the 211 system that serves the Atlanta metropolitan area that's run through the United Way. I suspect it was probably a conglomerate of United Ways that did the same thing in this area. Frankly, I don't know enough to talk about that, but it's a great service for the public, and if there's any way DFACs can help, we'd be glad to do that. If you ask that question, if you want to talk to me afterwards, we can learn more about it.
Is it possible to employ more family-centered practices?
Yes, it is. And family-centered practices basically just means that you have the family at the center of everything you do. You also allow them to make as many decisions about their family and what kind of services they're going to receive as they possibly can. The solution-based casework, which is the practice model that we have chosen, is based on family-centered practice. And so the way that we will work with families is to make sure that everybody's at the table when we're making those decisions to the extent possible. For those families that can select their own services, we'll allow them to do that. We know from studies that that makes it more likely that they're going to complete whatever we ask them to do. And so that's exactly the way we're headed.
We need more substance abuse programs in the area specifically for teens and the male population. Is this something that may be considered in Region 11?
Yes, indeed. And Stephanie has a subcommittee that's working on mental health services in particular. Stephanie, you want to take that?
Yes, part of the reason is as we have traveled through the state, the one issue that has come up time and time again is the shortage of mental health services available to children. Older adolescents, once they're 18 and over, you can generally find, but the younger ones are particularly problematic. So we're going to be looking at what are those access barriers. Are they policy related? Is it more that we just strictly don't have enough folks? We're going to be looking at how we can deploy telehealth more effectively throughout a lot of counties. Chris Kids is one example of a not-for-profit that's using telehealth very effectively for the families that they serve. So we think that there's a lot of opportunities to expand services kind of creatively. But also the bigger factor, I think, is having people talk about this issue. One of the biggest things that we sometimes encounter is that a lot of people don't recognize that very young children have social emotional issues that result in behavioral and mental health disorders. But if you look at the 4 through 12-year-old population, Medicaid population, they are the largest users of psychotropic drugs in the state. And that's the 4-year-old to 12-year-old population. So, in fact, the top 5 drugs administered or paid for by the state are psychotropic meds for kids. So, we know that this is a huge issue. It's impacting our school systems as well as our juvenile court system. So, if you have thoughts, ideas, if you've seen barriers, we have a drop-down box on the governor's website. It says Child Welfare Commission, and there's an email place there. We would welcome any observations you had, thoughts, suggestions, whatever they may be, as our subcommittee begins working on mental health.
There's also a study committee that's going on in the legislature right now that pertains to children's mental health. I think that's being led by Representative Kate Dempsey. She is a representative out of the Floyd County area. I know that also Representative Penny Houston is very interested in children's issues. Not certain if she's on that committee or not, but they're looking at these issues. I have to tell you that I have these conversations with the commissioner of the Department of Behavioral Health on a regular basis. He and I work together quite a bit. What we have seen in the state of Georgia over the past few years is that we've had to turn our attention because of a federal lawsuit to the adult mental health system. And very much of the attention has gone there because of the urgency of getting those things resolved from that lawsuit. But we have in turn neglected the children's mental health system, and the problems in the children's mental health system are significant as well. So I'm very pleased about the fact that the legislature is looking at the issues in children's mental health. The good news also is that Frank Berry came from child and adolescent mental health. That's his background, and so I'm very positive about the future for child and adolescent mental health. Now, the other thing that is noted here, Regional 11 is not alone. Region 11 is really just about anywhere south of Macon, unless you get over towards Savannah. You have a lack of providers in mental health. You also have a lack of providers in specialties of all types, and you have lack of providers that are pediatricians. And so part of what we have to talk about with our Department of Community Health, as well as the Department of Behavioral Health, is how do you incentivize providers to work in areas where the population centers are not? Most people want to get into the population center so they can have a larger clientele base. We need to, as a system, figure out how we're going to incentivize those providers to come to these small areas. Other states have done it. We can do it as well.
What do you think a child would be in care for almost 3 years?
That could be a variety of things. 3 years could be anything from us trying to work with the parent to get them back with the child. And, you know, I've seen situations like this where you get right to the point of reunifying the child and the parents' problems reemerge. And oftentimes our courts will give them chance after chance in order to try to keep the family together. That's one part of it. Another part of it is we oftentimes have children that come into our care that are severely emotionally traumatized because of the kind of abuse or neglect that they have suffered at the hands of the people that are supposed to love and care for them. And they exhibit behavioral issues that make it extremely hard for us to find a family that is capable of caring for them. So a lot of times those kids that have been in our care that long also have been in and out of the most high levels of our behavioral health system, including inpatient psychiatric care. And so those are some of the things. There's a wide variety of things that can account for that. The important part here, though, is, and I think that the intent behind the question, is children ought not be in the system that long. Our goal is to get as many out within 12 months as we possibly can and do it safely. At the very least, we want them out within 24 months. Federal law and state law requires that if you have a child in care for 15 out of 24 months, and they don't have to be consecutive months, we have to consider at least filing for a termination of parental rights. I think in many cases we try for a termination of parental rights and we're not able to do it. I call it the death penalty of parenting because it severs the entire relationship with that child and any of their birth family. And so courts oftentimes will give parents chance after chance, and oftentimes the juvenile courts will find the appropriate findings and terminate parental rights. Then they're appealed. It goes to the Court of Appeals, and we've been getting several that have been kicked back by the Court of Appeals saying that we need to work further with the parents. It's a wide variety of circumstances, but the important part of it is we're working as hard as we can to get as many children out as quickly as possible, but to do it safely.
What can be done to increase the percentage of siblings being able to stay together and are adopted?
That's a real challenge. The sibling, keeping siblings together, I think, is an essential. There are factors that can make that difficult. Oftentimes, we are now seeing sibling groups that are much larger than what we typically see. I've seen in the recent past a group of 7 and a group of 11 come in. And so the maximum capacity of most foster homes is 6. So that makes it very difficult. But the important thing I think for us to focus on here is that siblings need to remain connected unless there's a very, very good reason why they cannot. If they can't be together and there's not a good reason for them not to have regular contact, we need to be working to make sure that they have regular contact. So with the group of 11, what we tried to do is to make sure that we had foster homes that were very close in proximity to one another and they could have almost daily contact. It's a challenge sometimes, and especially when you're in an environment where you lack foster homes already. Those really particular kind of situations are very, very hard. But again, the question is made with the spirit that I think we work, which is we ought to keep those kids together as best we can.
We're going to have about 5 more minutes for question and answers, but I want to make sure that you know that your questions will be answered. Those of you that put your name and contact information, we will make sure that you get that information, the answer to your questions. So just to let you know that. Why not release more of the children into adoption of families that are qualified to provide permanent care? And then it said early, and I don't know if that was early county or early release. But it says, why not release more of these children into adoption of families qualified to provide permanent care?
So it sounds like we're talking about the families that are what we call foster to adopt, meaning that their intention is to foster long-term, and if the child becomes available, they will adopt. That would be our preference. What we try to do is to allow foster parents to make the selection as to whether they want to be a foster home. Some just want to be an adoptive home, so they don't want a child that has to go through all the legal steps still. If a child's free for adoption and it matches their family, they'll take the child. Then there are other folks who do what we call legal risk adoption. So they will take a child who does not necessarily have all of the legal steps completed. For instance, one of the parents may not have their parental rights terminated. So you still got to go through that process. So we try to attract as many different types of foster parents as possible. I think at this point, we don't have the luxury of being choosy, and what we do is take the foster parents that we can get, and we have to make some really tough decisions sometimes. We have to decide between, do we keep this child as close as possible to their home of removal so that they can stay in the school where they came from, so that they can continue to attend church where they're accustomed to going, or do we move them outside the county in order to put them in a foster home that is foster to adopt. Those are really hard decisions, but it is really a problem that is exacerbated by the fact that we just have an overall shortage of foster homes the way it is.
With the focus on normalcy in children and care, how will the department address the financial needs that may accompany this, such as cheerleading fees, club fees, uniforms for work?
So there are a couple of ways that we can do this. The department, for those of you who may not know, we've just gone through, as Stephanie mentioned in her presentation, something called prudent parenting standard. And so this just sounds like common sense again. Again, common sense ain't so common anymore. We had, for many years, and I take as much credit as anybody because I wrote many of the policies that govern foster care. We've been so protective of our children that I think it has been to their detriment. We find people who are appropriate to foster. We do all the background checks. We do criminal backgrounds. We do everything that we need to do to satisfy ourselves that that foster parent is appropriate to care for a child that's in the custody of the state. For many, many years, we have not trusted them to then make decisions that any other parent would make. So we made them ask for permission on things like, can you have a sleepover? I think Stephanie named that earlier. And the effect was that it was very frustrating for foster parents, very, very frustrating for the kids, and we really denied them a normal childhood, or a more normal childhood, as normal as it can be in foster care. And so we've come to recognize that we were really doing harm to children, and that we ought to be trusting our foster parents to be able to make some really basic decisions like that. We still have to ask for some big things. Even the department can't, for instance, approve major medical procedures like surgeries. We have to get the court to approve those things, but we're given a lot more freedom to foster parents to do those things, and I think that is going to improve both to the benefit of the foster parent and to the children. And I think that there was another part of that, and I may have missed it.
Bobby,
Yes.
one of the things is around, the budget for that, because uniforms can be expensive. Child cheerleading has, all kinds of hair bows and things that they need. And I think that's one example where the faith-based community can, or even the community or a local Rotary or some outside group can come together to specifically focus on the foster care population within that given community to provide those type of out-of-school experiences for those children and it not be a financial burden to those families. Typically, within a given county, the numbers aren't huge. And if enough people came together, those costs could be covered for those children. But I think that's a great initiative for a community to take on to help defray some of those costs for the foster parents who are already taking care of those children.
That's a great answer. And I'm sorry I can't recall the name of the initiative. There's an initiative going on in this area right now.
Call to care.
What's it?
Call to care.
Call to care. A group of folks saw a need and stepped forward, and they're asking for the things that foster children need that we may not be able to pay for as a department. Government money, as you know, is pretty well restricted around what you can and cannot buy, and it is typically for really essential things. And so, in my experience as a social worker, I always went to churches when I couldn't buy the things that kids needed. And churches never turned me down. I've always had good experiences with them helping. I think this call to care is actually has a faith component to it. The counties also have small amounts of money that are allocated to them by their local county commission and help. I think the boards help administer those funds for things like this. So as you're talking to those people who are on your county commission, not every county does this, but it's very helpful if a county can allocate some money to the county department to be able to have some flexible funds so we can do things that are special for foster children that really, it's just doing things for them that every other child's going to get. It just breaks my heart to think of kids going through things like prom and not being able to go to a prom because they can't afford a dress or a tuxedo. Going through and not being able to get their class ring like everybody else does. And so those kind of flexible funds are things that are really badly in need. And if you know county commissioners, please encourage them to give more if they can to their county departments so that they can do more things like that.
We have time for one further question, and with a lot of these, those of you that wrote the cards, I had to shorten them a little bit just to expedite the question and answer session. So if I didn't get it exactly right, please make sure you talk to me or one of the other, particularly one of the defects workers that will be able to explain. The last one is, does the division have any plans to incorporate the CANS, ANDs, which the Department of Behavioral Health is using into its practice?
I think I know what you're talking about.
I don't. So.
I think I know what you're talking about. I think the CANS is a developmental assessment that's being used by the health department that's pretty new. There's another one that is used called Ages and Stages questionnaire. And basically, what these instruments do is try to give you an idea as to whether a child is developing in a normal, expected pattern. And so these are things that ought to be happening in the medical exams that we have for children. Every child has to have a medical exam as soon as they come into care, and then they have to have regular follow-up exams for well child checks. And those things should be happening. Typically what happens is that pediatricians do these. Some counties have them done at their local health department, but pediatricians do those, and they use the instrument that's used by the American Academy of Pediatrics. Great question, then.
You may also want to talk about movement from doing more trauma-informed care,
Yes.
and what that means.
So one of the things that we are doing that we haven't done previously is when a child comes into care, we do a trauma screening. And basically what we're looking for is to determine how traumatized the child is. Do we need to get immediate assistance for them in psychological terms because of the trauma that they've suffered. This is a relatively new process for us, I think, over the last couple of years. It will be re-emphasized as we enter into our new practice model because trauma, both of the parent and of the children, has to be understood for us to be able to do good assessments of the family. So that is very important.
And the other reason that is also so important is because what may look like a developmental delay because of maybe some cognitive issues going on with the child may actually be in fact stemming from trauma that has not been dealt with appropriately. So we're trying to help these children in the educational path. Knowing this piece of the puzzle is critical for how you move forward with them into the future. So I can't emphasize enough about this trauma aspect.
Well, what we know about trauma is, and she showed a graph about this, but the more traumatic events any person has, the more likely they are to have serious health consequences later in life. There have been some pretty large studies done that show things like if you've had 3 or more major traumatic experiences in your life, they call it adverse childhood experiences, it is predictive of things like heart disease, diabetes, and cancer. And so if you intervene on that, you can lessen the likelihood that those things would come to pass. But you have to know about it before you can treat it. So that's a great question. Stephanie, do you want to say anything in closing?
Yeah, well, first I want to thank everybody for bearing with me via teleconference. It's not how I wanted to be there. I'd much rather have been driving to Valdosta than dealing with debris on the side of the house. But so just wanted to say thank you. And again, please don't hesitate to reach out to us through the Child Welfare Commission if you have thoughts and ideas. We are looking at child mental health, foster parent support and recruitment, case manager support, and finally technology. Those are our 4 subcommittees for this year, and we'll be coming back to the government for those recommendations. So if you have any thoughts in any of those 4 areas, please drop us a message, and we'll be happy to take that into consideration as well.
Thank you, Stephanie. And I truly want to thank you for going to the extra effort that you've done today. I thought for a few minutes I was going to have to sing and dance, and none of you want me to do that, I promise. So thank you for joining us, Stephanie. I just wanted to close with a quick story. When I was at the Department of Early Care and Learning, I had the great pleasure of being able to tour the state and look at the very best child care facilities we got going. Very pleased to see that you got one of the early education empowerment zones. I actually wrote that grant, that portion of the grant, and so pleased to see that you've got about $1 million that's been put into the system. The story I want to share with you, though, is out of the East Lake community. I don't know if that community is something you'd recognize, but the East Lake community is in Atlanta, and at one point in the 1970s, it was known as the most dangerous community in America. And it was an area where the police would not even go after dark. And so through the years, it was surrounding one of the old high-rise housing developments. And through the years, a group of community members came together and decided to revitalize that community. And they did it starting with a child care facility. They found that everybody in the community could come around the needs of getting good early childhood education, good care for kids. And so I was able to tour there, and it's an exemplary facility. They were showing me something called Strive for 5. Strive for 5 is a system where you engage a child and you try to ratchet language, so you get them to use more complicated language at least 5 times. It's a tough thing to do. I got them to go 2 levels myself. And so we were walking around. There's a lady there named Cynthia Coleman who is on the board that the philanthropy that funds it. And Dr. Coleman was walking with me, and she was showing me some things the kids were doing. And she engaged a table of kids using the Strive for 5 method, or was trying to. And we walked up, and there's a little boy sitting at the head of the table, and he was drawing an owl. And she said to him, "Well, young man, I see you're drawing an owl." And he said, "Yes, ma'am, and owls are nocturnal." That 4-year-olds, nocturnal. And so she said, "Well, tell me about nocturnal." He said, "Well, that means you get to sleep all day and play all night." We walked around. There's a little boy sitting on the other side of the table, and she said, "What are you drawing?" He said, "I'm drawing a bat, and bats are also nocturnal." And she said, "Well, tell me about nocturnal." And he said, "Well, that means you get to sleep all day and play all night." And we walked around the other table. A little girl standing there just coloring away, having a good time. And Ms. Coleman said, "Honey, can you tell me about nocturnal?" The little girl stood up, put her hands on her hips, and she said, "Ma'am, obviously you've not been listening." I thought that was just a really, really great, funny story. I could not wait to get back to the office to tell it. Frankly, I've been in my role as commissioner for about 2 or 3 months at that point in time. And so as I was leaving there, driving back to the office, I thought to myself, wow, what a cute story. And then it just dawned on me, this is a lesson, out of the mouths of babes. And what it was saying to me was, you need to listen. And so that has been something that I've tried to do from that point forward is listen to the people that I work for. I work for all of you. And I want to do the best that we can do for the children of the state. And so hold me to that. If you ever feel like I'm not listening to you, if you ever feel like your local county department's not listening to you, I need you to call us on that, because we can't do this work without you. I appreciate everybody being here tonight and taking this time out of your busy schedules. I know you could have been doing many other things, but this is truly heartwarming to see a group this large come out to talk about the welfare of children. We do appreciate it. Have a safe trip home.
Yeah,